So the deep back line in the sort of School of Anatomy Trains by Tom Myers connects the quadratus plantae of the arch of the foot all the way through the gastroc and soleus, the three different hamstrings, and the adductors, through the ischial tuberosity to the sacrum, paraspinals all the way up through the cervical spine right to the crown of the head. This fascia links everything at a cellular structure level. You can think of the skin of cells just binding to form this long sheath that connects. And the bridge of this on the back body is the sacrotuberous ligament. Again, two words: sacrum, this triangular bone at the base of the spine; tuberous, ischial tuberosity, part of the pelvic structure. And in between the two, there's a connection of ligamental tissue. So remember, ligaments don't have a blood supply, and they tend to not be too fluid, right? Once they're fixed in a position, they're solid there, and unless they snap. There's a couple of ways that you can approach treating this. A restriction here can be assessed, just sort of bringing the heels of the hands or the thumbs just to kind of assess that pelvic tilt from the prone position. I like bowing the ligament. Even though there's not nervous tissue per se a la the Golgi tendon organ, like a tendon would have, there is nervous tissue in there. And so thumb, ischtube, sacrum, kind of on the plane of the greater trochanter inwards, that C shape is actually going to be a position for me just to drop my elbow in. And this ulnar border is going to allow me to plug my upper arm bone back into my shoulder girdle and just use my body's weight to bow the tissue. Make sure that you're in that space in between the two, and it's just going to give you a really nice release that will travel throughout the whole back line. The other way to approach this is through an osseous compression. Now, making sure that you've kind of got the ischial tuberosity in the heel of the hand, you want to find that straight line, because the sacrotuberous ligament does translate all the way up to the top of the sacrum and that sacral border just below L4. So I can come to that edge of the sacrum, and the heel of both hands are just going to load three-dimensionally in towards the center of that tissue. So by bringing the two borders towards one another, I'm essentially communicating to the nervous system, you can turn off, that there's less tension here, and so it's kind of like a fascial unwinding, except in compression as opposed to cross hands, for example. I want to stay with the tissue. My breath is going to affect it, so me remaining calm, just staying composed and spacious. Really palpating down to depth. As with any fascial structure or release, we want to know the tissue, and so landmarking is going to be of the utmost importance. After that, loading to tissue depth, and then just listening and following. Again, their breath can come in handy. We can just find that release and travel with it. And just allow it to almost float us out of tissue depth. It's almost, in a way, it's like swimming. John Barnes thinks that, most fascial releases are going to take about 5 minutes to complete, because you're looking at that three different tissues. You want to warm the ground substance, the glycolic acid has to soften, and heat is going to do that, and the water that's in the tissue is going to be the medium within all that takes place. And so as we watch that unwinding, just allow it to push us out. And again, reassess. Just want to take a moment, check in on the pelvis, make sure that the tissues have moved in the way that is in best service to the individual, and make sure that you do it on the other side.